So, as most of you know, my name is Emily. I'm the owner of Wings Physiotherapy, and tonight we're going to talk a little bit about posture. So, just a little disclaimer that this is not individual medical advice. This webinar is supposed to be educational, but if you're having any pain, if you're having any true musculoskeletal issues with your posture or anything, that this is not meant to replace evaluation and treatment by a licensed healthcare professional, like a physical therapist or a physician. So let's start by talking just a little bit about posture. So posture is kind of a combination of your bones, your connective tissues, like your ligaments and your tendons and your muscles. They all play a role in your posture and making it what we call good or bad posture. If you have quote unquote bad posture, this can lead to a variety of different musculoskeletal issues like headaches. You can get backaches, you can have neck pain, shoulder pain. It can lead to nerve compression and then start to lead to symptoms like a sciatica, all kinds of different things. Now, this isn't to say that if you have bad posture, you're going to get these things, but over time, having this bad posture repetitively can lead to changes in your spine, changes in the muscles, and that can lead to these issues. The entire body plays a role in your posture. So the posture at your wrists and your elbows, your knees and your ankles all can kind of play a role into everything. But for the purpose of this webinar, we're mainly going to focus on the spine. So the neck, the thoracic spine, the lower back, and the pelvis, and how that relates to posture. So if you look at this picture over here on the side, you can see the different parts of the spine. So this purple highlighted part at the top is going to be your cervical spine or your neck. The thoracic spine here is what's between your neck and your low back or your lumbar spine, and then your pelvis, which includes like your SI joint and your tailbone. You'll notice here that this is pretty normal alignment, that we don't have a stick straight spine, that there's actually these natural curvatures in the spine, which help with things like transferring loads and keeping the discs and everything healthy. So on your neck, there's actually a little bit of a curve towards the front. As we get lower, kind of into your mid back around your shoulder blades, there's going to be this curvature towards your back, and then the spine curves in kind of towards your stomach again around the lumbar spine and the pelvis. So just kind of take a little mental note of that. That's kind of what we want the normal posture to look like. So what does good posture look like? Let's see, let's start. This picture, the one on the left is kind of what we would call bad posture, and then the right is what we would call good posture. So I'm actually going to draw a little line through his ear. So a lot of times when we look at our posture, we start by looking at the ear and seeing where that lines up with everything. So I'm going to draw one there and one here. It's not perfectly straight, but. So if we look at this bad posture picture, you'll notice that this line that goes pretty much through his ear, and then let's look at his shoulders. Ideally, we want his shoulders and his arm to line up with his ear. And in this picture, it's not. His head is kind of forward too far and getting an extra curvature in that neck or that cervical spine. Here in the good posture picture, you can see the shoulder and the ear line up a little bit better. So his neck just has that kind of slight curvature here that we would want to see, versus here, it goes really far forward. So then here, let's look at more of the thoracic and the lumbar spine or the back. So here, we've got this large curvature. Now remember, when we were looking at the other spine, the neck should curve this way. And then in the thoracic spine, we get a little bit of that backwards curvature, and then this way. In this bad posture here, this is over exaggerated, and this curvature is way more than we want it to be. Whereas here, it's a little bit more normal. So when we're looking, the back is nice and straight here with just that mild curvature. Here, there's actually no curvature at all in that lumbar spine. It's actually going the reverse direction, which over time that can lead to disc problems and nerve compression, a lot of lower back pain. As a physical therapist, when I'm treating back pain or neck pain, one of the first things we want to look at is posture, because being in a bad posture for long periods of time, if you're sitting all during the day and you're in this posture, you put a lot of extra stress and you stretch out these muscles here, and the ones in the front get really tight, and then things start not working the way that they were designed to work. And then let's take a quick look at the pelvis. I don't know how to get rid of this. Okay, there we go. So let's look at the pelvis. So normally we want this neutral pelvis here. This is looking at you from the side. Your femur or your thigh bone would be coming out of the hip socket here. So normally we want this nice neutral alignment where it's flat almost. Here is going to be a posterior pelvic tilt, which is not necessarily what we want. And the hip bone is actually rotating backwards in this direction. As we do this, our butt muscles start to get really tight. The muscles here in the front of the abdomen and the thigh start to get really stretched out. And when the muscles aren't at the length that they were designed to work, they just don't work as well. They either get really tight and weak, or they might be too stretched out to where they can't actually contract really well. The opposite is going to be an anterior pelvic tilt. With the anterior pelvic tilt, this pelvis is going to rotate forwards. So your tailbone comes up a little bit. In this posture, we get more shortening of those muscles in the front, and then the ones in the back get stretched out. So the opposite of the posterior pelvic tilt. Ideally, we'd be here in this nice neutral posture where nothing is too tight and nothing is too stretched out. So let's kind of put all of these together. So we just talked about that anterior pelvic tilt. So if you look here, that pelvis is tilted forward. And now as a compensation, we have to overextend our back and arch our back really high so that we stay standing up nice and straight, which is what we don't want, because now that's going to lead to more low back problems and things like that. This posture here on the far left is a compensation because we're not using our muscles to hold us up. So we actually kind of lean back and use the ligaments in our hips to stand up nice and tall. So when you're standing, just kind of check it and see, where are my shoulders? Are my shoulders really hunched forward? Am I pushing my pelvis forward, kind of thrusting it forward like in the slayback position? How about my back? Is my back really arched, or is it kind of curved like this one? And then check in with your head too. Is your head really far forward, or is it in that nice neutral alignment where your ear and your shoulder can line up with each other? This one on the far right is kind of our ideal posture. You see this line going down. The ankles, the knees, the hips, the shoulders, and the ear are all in this nice straight posture. If you want to at home, you can have somebody take a picture of you from the side. A lot of times with iPhones and things nowadays, you can draw on the picture, draw that line and kind of see where things fall in that. Just for fun, I'm going to draw a line on all of these through that ear so we can just kind of look real quickly at it. So if we look at this one, the ears and the shoulders are lined up pretty well. So the neck probably has good posture, but then as we go down, the hips are really far forward. The knees are really far forward, but then we're lined up with the ankles. So while these three, the ear, the shoulder, and the ankles are nice and lined up, the knees are really far forward and the hips are far forward, which can lead to lots of other issues. So then same thing with this one. This is just kind of what you can do if you take a picture of yourself at home. Now we look, the ear and the shoulder are nice and lined up, and so are the knees and the ankles, but the pelvis or the butt is really far back, which isn't good. And then we get that extra curvature in that low back. And then same thing here. So now the ear's a little bit forward from the shoulder, but the shoulders are a little rounded, but you'll see the hips are really far back. The knees are starting to get back and the ankles are far back too. And then for the last one, now this one I'm going to draw two lines because I want you to see that everything else is for the most part lined up, but that ear is very far forward because we're extending our neck. But the shoulders, the hips, the knees, and the ankles are fairly lined up. Ideally, we'd have this nice good posture here. So now that we've kind of talked about what good posture looks like, We're going to go through different exercises that you could do in order to help you get better posture. Like I said before, this isn't necessarily medical advice. And if you are having pain and issues, I would try to get in to see a physical therapist, because over time, as we have bad posture and we start to get these poor movement patterns, these can lead to compensations either up or down the chain. So if I have an issue with my shoulders and my neck being forward, over time that can actually lead to upper back pain and lower back pain. And a physical therapist is somebody that's really trained to look at the whole body and help you to address all of these issues versus just focusing on one area of the body. So the first exercise is what we call the chin tuck. So this is going to help to address that neck posture that we have when it's really far forward. So essentially what you're doing is, if you have that forward posture, you're just going to tuck your chin back like she's doing in the picture. When you're doing it, it's important that you're getting a backward motion of your head this way versus tilting your head up and down. This is not what we want. It's almost like you're trying to give yourself a nice double chin when you're doing this exercise. When you're doing it too, as you go back, try to hold it for a few seconds before you relax again, back and forth. This will help to strengthen the muscles deep inside the neck and the cervical spine to help get you that better posture. Another one that you can do is what we call the scap squeeze, or the shoulder blade squeeze. So this right here would be your shoulder blade. You're trying to bring your shoulder blades and squeeze them down and together. Same thing like with the chin tuck. When you squeeze, you want to hold for a few seconds before you relax, and doing that multiple times. One important thing with this one is, a lot of times when we try it the first time, we squeeze our shoulder blades up and together. We don't want that, because then we're going to start to really tighten your upper trap muscle, which runs here. So really focusing on a backwards and down motion versus backwards and up. You should feel it working the muscles right here in between your shoulder blades, not up here on the tops of your shoulders and into your neck. Another good exercise is going to be the wall angel. So you're going to stand up against the wall, try to keep your back and your neck and your head all flat onto the wall, and you're just going to slide your arms up and down this way. As you go up and down, you really want to make sure that your back and your head and your neck all stay flush with the wall. If you're having a really hard time sliding your arms up and down, there's a good chance that you have some muscle restrictions, like in your lats. Could be your low back. Physical therapist would be a great resource to help you address where that issue is stemming from. Another one I really like is cat-cow, or sometimes it's called camel-cow. This is a really popular exercise in yoga, and it's also really good postpartum. So you'll start on your hands and knees, and then you're just going to alternate between these two positions. So you're going kind of end ranges on opposite ends of the spectrum. So in this one, you're arching your back up as much as you can. And then this one, you're going to arch your back down towards the ground as much as you can, kind of doing a nice flow between each one. With this one, you can actually coordinate your breath. In one motion, do a nice big inhale. And then as you go into the other motion, exhale. The hip flexors are one of the really stubborn muscles that are notorious for that anterior pelvic tilt that we talked about, where your pelvis tilts forward and then your low back has to overextend to compensate for it. When the hip flexors get really tight, they pull that pelvis into that forward position. So in order to address that, we want to stretch them out. So with this exercise, you can start in a lunge. By the way, there's many different positions that you can stretch your hip flexors. You can Google all kinds of different ones. But this is one that's pretty good for just about anybody. If you're having knee pain, kneeling on your knee, you can always put a towel or a pillow under it. But what you want to do is keep your hips forward, go into this lunge position, and then just lunge forward, lean forward into that front leg until you feel a nice, good stretch in the front of your hip. Now, when we're doing stretches, it's important that we don't just hold them for a few seconds. A lot of times when we stretch, we hold something 5 to 10 seconds. We really want to hold it 30 seconds to a minute if you can, because that's going to help us actually get a change in the muscle fiber. When a muscle is short, all the muscle fibers are really close together like this. And if we only stretch for a few seconds, we pull them apart and then they go right back together. If we hold it for that 30 or 60 seconds, then we're actually going to get a physical change in the muscle fibers and they'll separate, and they should actually stay this way. Another stretch that I really like to give people for posture is a pec stretch. So when we have that kind of rounded shoulders and forward head posture, the muscles right here in the front of your chest tend to get really tight, your pecs. So you can actually stand in a doorway and help to open up that chest and stretch them out. So in this picture, she's using her front leg, she's leaning into it so that she can control how much of a stretch she gets in the front of the chest. With this stretch, there's different orientations of the muscle fibers, so you can kind of play around with how high or how low your hands are. Find the spot where you feel the best stretch in the front there. Same thing, making sure you're holding it for 30 seconds or a minute so we actually get a good change in the muscle fiber length. And then another exercise is the pelvic tilt. So you can do this laying down, you can do it sitting on a ball, sitting on a chair, you can even do it standing. If you have a stability ball or exercise ball like this at home, this can actually help you get the motion a little bit better as your body's learning how to do it. But you're essentially, this would be the side view, he's sitting here on the ball, just tilting your pelvis back and forth so that it can kind of feel what it feels like to move that. If we're stuck in this anterior pelvic tilt, it's important that our muscles learn how to get back into this neutral position, focusing on that posterior pelvic tilt. Vice versa, if you have a posterior pelvic tilt as your kind of normal resting posture, we want to work on going anterior or forward so that our body learns how to get back into this neutral position. And then bridges are another good exercise. So as those hip flexors or those muscles at the front of the hip get really tight when we're stuck in a tilt this way, we need to stretch the front, but then we also want to strengthen the opposite muscle so that we don't stretch and then go right back into that posture as we go throughout our day. So with bridges, this is going to be a really good exercise for the glutes or your butt muscles. You're going to start with your knees bent, just lying down. You can do this on the floor, on the bed, wherever you're comfortable. And then practice lifting up and down from the hips. As you lift up, it's really important that you try to squeeze your butt muscles so that those will activate. Sometimes if your butt muscles aren't activating, you'll feel it in your hamstrings or the back of your thigh, and you won't get any kind of activation of the muscles in your butt. So really make a conscious effort to think about squeezing the butt muscles as you go up. All right, so like I said, this wasn't necessarily intended to replace treatment or evaluation by a physical therapist or any other healthcare provider, but just to give you kind of an idea of what good posture would look like, and then some good exercises that you can use kind of as a preventative thing or as a maintenance thing if you do have issues with your posture. But does anybody have any kind of questions? You can either put them in the chat or unmute yourself.
How often should we be doing these exercises if we have bad posture?
It kind of depends on if you're having any pain or anything, but ideally we like to do any strengthening exercises at least 3 times a week. So if you're only doing a couple exercises, it shouldn't take you more than 5 or 10 minutes to do. Depending on what exercise you're doing, like if you're doing the shoulder blade squeezes when you're driving, can be a great time to do them if you're just sitting there. You know, every time you get to a red light, squeezing your shoulder blades back 10 times. Does that answer your question?
Yes, thank you.
So there's another question. If I'm consistent with these, how long will it take to see improvement? I have 20 years of bad posture to fix. So that depends, one, on how bad your posture was. Typically, the longer that you have had an issue, the longer it's going to take to get it back to normal. But if you're not having a lot of pain and other issues, then you probably don't have a ton of compensations from the body. Everybody's a little bit different, but you should start to see at least a little bit of a change in your posture after about 2 or 3 weeks of doing the exercises. And then as you continue with them, you should start to see it slowly improve. But in order to see that initial improvement, probably about 2 or 3 weeks. So if you have any questions, you can call me. My website is there. My Facebook is there. You can email wingsphysiotherapy@gmail.com, or even on Instagram. Dr. Mtastic is my screen name. I'm always posting all kinds of educational stuff there in reference to pregnancy, postpartum, the pelvic floor, getting back to exercise. So yeah, any questions, feel free to reach out to me. I'd be more than happy to help.